Hi everyone, it's Dr. Ansari. We're going to be talking about surgeries for stress incontinence, which is leaking with a cough, sneeze, or a laugh. There are basically two types of surgeries. One is minimally invasive, and the other is, I'll just call them bigger surgeries, okay? Minimally invasive, we have two kinds. One is the mid-urethral sling, and the other is urethral bulking. So mid-urethral sling is our gold standard, meaning it gives us the best success rates with the lowest complication rates. Okay, so 90% effective, and again, of all the types of procedures that we do, in terms of its effectiveness, it does have a lower complication rates when compared to the bigger surgeries. Okay, so that's why it's our gold standard. It involves placing a mesh under the urethra to kink the urethra. Now, if you saw in my conservative therapy video for stress incontinence, the way I described the incontinence pessary kinking, that's the same way the sling kinks the urethra. So, but the mesh does it. The mesh is supposed to be a permanent implant, okay? There is a 5% mesh complication rate, but that we consider to be pretty low. And in very experienced hands, you're going to have lower rates. Next is urethral bulking. Urethral bulking is about 70 to 80% successful in achieving improvement in your stress urinary incontinence. It does require repeat injections. Okay, sometimes just to get the max effect, you might require another injection a month or two from your first one. And then overall, once you've achieved your max effectiveness, the maximum effect, then you likely will actually have to repeat the injection every couple of years, because it doesn't last a long time. It lasts about 2 years. But depending on the type of bulking material that's used, it could last more than 2 years too. There's some newer ones coming out that last a little bit longer. The sling, by the way, can last 10 years or more before it gives out. Okay? Nothing lasts forever. Now, bigger surgeries. There are two main bigger surgeries. One is called the birch, and the other is called a pubo-vaginal sling. And I'm not going to delve too much into these, but these are procedures that might be done if, let's say, you're having a robotic hysterectomy and your doctor is in the abdomen already, so your doc might choose to do a birch at the same time, which is supporting the urethra with some special sutures. If you've had a mesh complication in the past with a prior vaginal mesh or maybe even a prior sling, and you're having a lot of stress incontinence after dealing with that complication, then you might require a pubovaginal sling, for instance. That's basically creating a sling out of your own tissue, and that tissue is harvested or taken from either your abdomen or your thigh, and creates a sling that we then put in. Now, really, these surgeries are surgeon dependent. It's whichever one that your surgeon maybe is the best at, or does more, or maybe your surgeon says, one procedure is better than the other given your particular history. So when it comes to any kind of surgery, remember that these are individualized, and not everybody is a candidate for every kind of surgery. So really talk to your doctor about which approach is best for you if you decide surgery is the way to go. and your surgeon will talk you through, the pros and cons and what you're eligible for. Thanks.